Hello, friends. Welcome to the Veterinary Life Coach Podcast. Today, I have a wonderful return guest for you. His name is Dr. Lee Pope. He's a seasoned veterinarian with over 13 years of experience in small animal medicine, surgery, and practice leadership. He's a graduate of the University of Georgia College of Veterinary Medicine. He spent nearly a decade as the owner of Lawrenceville-Suwanee Animal Hospital before serving as co-medical director for CareVet's Lawrenceville-Suwanee and Premier Veterinary Hospitals. In these roles, he combined hands-on patient care with strategic leadership, developing medical protocols, mentoring veterinary teams, and optimizing operations. He now serves as Veterinarian Services Consultant for Revelation Pharma. He leverages his expertise in diagnostics, surgery, and personalized treatment to advance veterinary medicine. And he was most recently certified as a pet grief support specialist. And that's why I had him back today to talk about pet grief support. Welcome back to the podcast, Lee.
Thank you, Julie. I appreciate you
Thank you
having me
so
back.
much. Yeah, it was a mouthful of an intro, but I had to get it all in there because it's all good stuff.
I appreciate it.
So you got a recent certification and you told me about that and I was like, "Oh, that sounds like a good subject." And it's called Pet Grief Support Specialist. So can you tell me what that means, how it came about, why you decided to do it?
So, what it means, so pet grief support specialist, how do we handle death? It's and that's kind of always fascinated me, but it's just not talked about very much. So,
Okay.
how do humans handle grief? How do adults? How do children? How do different cultures handle grief? So, if you look at the surveys about how people view their pets, they're no longer animals. They're no longer inanimate objects. The yard dog that, it ran away and got run over, we'll just get another one. It's not a big deal.
Right.
Those older generations are now leaving, and we have the newer generation that this is my child. It's a very high percentage of people now that view their pets as family, and of that higher percentage, there's a small percentage that view them on the same level. Anybody that's been in veterinary medicine has had that client that said, I didn't cry this much when my dad died. I didn't cry this much when my mom died as I am over this dog. I
Right.
recently had a buddy that his dog died suddenly and traumatically, and it messed me up. I've lost weight. I can't sleep. I keep picturing him. So the study of death is always the idea of death has always kind of fascinated me and how we handle it. And basically, this came about when a cremation company had kind of reached out and said, "Hey, we used to have somebody that gave lectures. Would you be interested in this?" Looking into it, and then got the certification. I am race approved to give certain lectures. So the goal is, how do we help other vets and their staff handle death, handle euthanasias? Let's not just say your dog has cancer, call us when you're ready to euthanize, and then they come in, we euthanize, and it's literally a business transaction, and that's it. That weighs on the vets, it weighs on the staff. So how can we understand how people handle that a little bit better?
Yeah, I love that idea because that is training that we don't get, especially as new veterinarians. We're just kind of thrown in there and expected to figure it out, right? And it's probably one of the most difficult, but also most rewarding things that we do. And so I find that fascinating. So tell us about the grief process in general and what you've learned and what we should know about how that works.
Ooh. It was
I
interesting
know
because
there's a lot.
there was so much, but just the one thing that I found very interesting, everybody knows about the stages of grief,
Right.
right? But the interesting thing with that is that hasn't been validated. That was one person that came out and said, "Hey, I found these stages." Not everybody goes through those stages, and there are sometimes additional stages, and it's more acceptance now at the end. And some people jump around and do different stages in different orders. So
Mhm.
one thing that was interesting is that not everybody's going to go through every single stage of grief and loss. Um, just how different conversations about kids. Should the kids be involved? What is a vet to say if the client looks at them and says, "Oh, Timmy is 7 years old. I don't know if he should be here for the euthanasia. Do you think I should bring my kid?" That vet's in a very awkward spot because they're, I mean, that's y'all's decision. But what if that client is like, how do kids handle this? I don't know how to
Right.
handle it. So,
Yeah, that's a really hard question when clients ask you that, isn't it?
right. So even if you compare, we always compare ourselves to human medicine, just we have to deal with death. I feel like so much more than the human side, right? The dentist or the dermatologist or whatever, they never have to deal with death. And even like emergency room, yeah, they deal with it. But I mean, we have to tell that client it's time to euthanize, or we have to have that conversation with them. So just different ways of how to handle it. The old adage, he's in a better place, she's in a better place. Now we understand, no, you shouldn't be the first one to say that if the
Yeah, that doesn't
client
speak
says
to
it.
everyone's beliefs, right?
Right. And it's almost kind of like, well, I thought my dog had it pretty good with me, but I guess you're saying maybe was I not good enough for my dog and now they're in a better place without me. So
Yeah, like what does that mean?
right. So very interesting things, and just even it's okay to just be like, I am sorry. I am sorry for your loss. I'm here. Like you don't have we always want to fill it with some meaningful thing. We want to say the most perfect thing at the right time. And sometimes it is okay to just, I know you're really upset and this is really painful. And I am sorry for that loss. Sometimes that's okay to just say that.
Yeah, and it is almost better to just say that because you don't know that person's beliefs or their thought process or the degree of grief or how many times they've been through it. Um, yeah, it makes a huge difference. So when you were going through this certification, did they give you like recommended scripts or how we should handle it when clients call? Like was there like a way that we should do this or just, how do we discuss it in a better way with clients?
There wasn't really anything that had scripts, because the interesting thing with this is it was coming from the aspect of, okay, how just humans handle grief and loss with whatever it is, and then how do humans view loss of pets, how do children view loss of pets. So just making sure that we focus on the client's feelings. Okay, how do you feel about this? Are you okay? Do you want to be present? Just talking with them through everything. People want to know, they want to know what's going to happen. They want to know what to expect. So even it might even be something as like preparing for the loss. Okay, hey, I gave your dog a terminal diagnosis. Is there a group around that is almost a support group for kind of that impending loss?
Like that
And
pre-grief, they sometimes call it, right?
right. So you kind of get ready for that and talk about it. Sometimes you don't have time and it just hits you and you got to euthanize that dog today or that dog dies today. But if it's something, hey, this dog has cancer throughout its chest, get ready to say your goodbyes. Again, we've all had well, my kid's at college. They're coming home this weekend. Do you think that she'll make it to the weekend? Like,
Mhm.
I think she will, but we don't need to push it past that. Like, is there a way, hey, we know this local group or we work with this local group, or it really kind of seems like it's the cremation company's niche area to say, hey, this is a cremation company we use and they have a support group, or they have someone to talk to just kind of let you know how you feel. This certificate doesn't, we need to make sure that it's not, I'm not a therapist or anything like that.
Right,
I'm not a
right,
licensed therapist. But at the end of the day, how many vets are therapists, right? When
right. Well, we kind of play that role sometimes, even though we weren't
right,
trained to in a lot of ways. But I
right.
think the important thing that you're saying, or at least what I'm hearing, is that kind of customizing it for each situation and also not being afraid to offer that support group beforehand. Because I mean, I went through it. I still have my Trent, but a couple years ago, my dog was really, really sick, and he's old anyway, and I thought I was going to lose him. And I went through a lot of grief before I even knew what was wrong with him, because I kept saying he's going to die, and I can't figure out what's wrong with him. And as a vet, that was really difficult for me. And then once he, started to get better, I'm like, oh, I'm going to have a really hard time losing this dog, because I already grieved him. And so I think just knowing that that pre-grieving is a real thing that clients go through, and we don't really realize that all the time because we don't go through it, unless it's our own pet, obviously. But I
And
think that's important.
right, and you just, what you kind of hit on that, like you don't know what the client's gone through before that. So
Sure.
we can have compounded losses to where,
Right.
yes, we all deep in our mind realistically know we're probably going to outlive our pets. That's just the natural order. We know that. But
Right.
that client that's really upset about their older dog that has cancer, did they just lose a sibling? Did they lose a significant other? Did they lose their job? Like, they could be extremely distraught, and the vets, man, I don't really, I know they're upset, but this is much
Next level.
more
Right.
than it is. There's something else going on. And again, you never want to step on toes, but it's one of those, can we recognize that and say, all right, Miss Smith, Mr. Smith, I know you, like, this is really, really hitting you hard, and I completely understand that. If you're okay, I would like to give you the contact of a therapist or somebody to help with this transition, because I want to make sure that you're okay too. Yes, I'm a vet, but we
Right.
also understand this pain that you're going through.
Sure.
I would really like you to contact this. Um, or even guilt. Guilt was one of the things that was emphasized that will keep people in the grief cycle.
Yes. Yeah,
So,
I've seen that happen many times.
right, we all have, like, those are the clients that will sadly spend the money. My kid fell on the dog. I backed over the dog when I was back. I don't care what it, we will
Right.
spend
What
it
it
because
costs. Right.
I ran over the dog. And
Hmm.
then if you can't save that dog, that will be a client that's stuck in grief. My buddy whose dog died fell in the pool in his backyard. And we all, I mean, how horrible that is.
Hmm.
That guilt will keep you trapped, and recognizing that to say, man, Miss Smith, you really, I understand that how guilty you feel about this, and it's affecting moving forward. You got this dog and you're almost like panicking about every move you make.
Right.
I think it might be a good idea for you to talk to a therapist or somebody to maybe try to help you through this guilt so you can accept it and make it a part of your life and continue on.
So the compound grief can not only be that I lost a family member or I had some other grief that I'm tying to this pet, but also the guilt that comes with making the decision. Some people have a really hard time making the euthanasia decision because they feel guilty about that even. So that they call that kind of the compound grief. Is that what they kind of taught?
So yeah, the compound grief is more grief built on grief built on grief.
Got you. So like
More
other things that have happened in their lives with either pets or people. Okay.
more multiple. The
That
guilt is
makes
just
sense.
anything that, in our instance, it'll be I did this to the pet, or nowadays I can't afford. Hey, my dog's
Right.
diabetic, but I just cannot afford insulin and checking
Right.
the glucose,
Yeah.
or this surgery. Hey, I can do this surgery to fix it, or a surgeon can do it, but that's
But we
seven,
don't have the
eight, 10
money.
grand. And
Yeah.
okay, and then they have to tell their kids, well, mom, why can't we fix Fluffy?
Right. Right.
I'm sorry, but I do not have the money to fix Fluffy.
Yeah.
So that type of guilt can add on top of the grief. But the compounded grief is going to be more, hey, I just lost my job, I just lost my sibling, I just lost my other dog, I've
My husband
euthanized
died,
four
and this
cats.
is the only dog. This is our last dog that we got
Ooh,
together, and
yeah,
then it brings back the grief from the husband or something.
those were the worst. And
Those
then
are
you have
hard.
two in
Yeah.
our end. I don't want to get another pet because I'm going to outlive it. I'm 80 years old. I'm not going to get another dog. This dog
Right.
was tied to my husband. And then those are like, that's almost like with staff, depending on your client, you put, hey, even though we inactivated Miss Jones, why don't we call her like every
Right.
3 or 4
Keep
months
in
or
touch.
something, just to
Yeah.
kind of, because some people literally, that's, we all know they have nothing else other than their dog and the clinic is a reason to go out. The dog's a reason to
Right.
wake up in the morning, and I gotta get their shots and I gotta get their blood work.
Yeah.
um,
Yeah, I remember a story like that. One of my own clients who was quite old and she adopted this dog and it ended up at some point dying and she swore I'm not getting any other dogs and any other dogs. And so I did keep reaching out to her, how you doing? How you doing? And she eventually did. She found a dog that was an adult that needed a home and it kind of it was kind of meant to be. But and that's very joyful when that happens to see that kind of, somebody that needs a dog get one that needs a home. But yeah, I think it's a real thing because we get to the point where we don't know what to do. Like how did they talk about, Mrs. So and so's dog died. It was their only dog. They were a great client. Now what? Like what do we do as a practice? Do we just call them once in a while and say, "Hey, I was thinking about you"? Like what would be the way to keep that relationship going? Did they give you any of those kind of ideas?
there wasn't anything
Yeah.
like that, because the interesting thing with this is it was a good program and I learned a lot.
Right.
um, vet it really kind of seemed like more coming at it from like a clergy side or a cremation side.
Right.
There were there was one little book that was nice that kind of walked through the grief and loss, like, okay, have the client do this, have them set up an urn, have them have pictures, do a collage, stuff like that.
Yeah.
But the the interesting thing is it didn't really go into, all right, Dr. Jones, you just, this example, this is what you should do.
Right.
That's where, in my opinion, I think that burrows down to just what kind of business do you want to run, right?
Right.
Because we are salespeople,
Sure.
we are in a people facing business. So do you want that business of just, this is all transactions, or you know what, man, Miss Jones was a really, really good client and she was a sweet lady, everybody loved her, she knew everybody's name. Yes, let's keep in touch with her just to keep in touch, because no matter, I don't know, no matter how busy you are, there is always downtime. I don't know I've ever seen a clinic that is
Yeah.
truly from as soon as they open the doors till they close it every single day. They never get, there's always some sort of downtime. That one receptionist or that one tech, just give a call. Or even if the vet's slow, just give a call. Hey, I was just thinking of you. Um, vet, you might have to be careful because maybe it is that client that like traps you on the phone for 30 or 45 minutes telling you everything
Right.
about
Don't do it
their
when you have something else to do, right?
day. Right. So I think it's just keeping that contact, and even grief wise, just it's okay. How are you doing since Fluffy? Well, I'm doing okay, doc. Every day is a little bit better. That's great. Or man, I just still feel so guilty that I couldn't do more for her. I should have done more. No, Miss
Yeah.
Ford did everything great. I should have done
Right.
more. Well, it seems like you're really stuck in this grieving and having trouble.
Sure.
We have, let me give you a contact info, or let us email you over some information to for you to be able to speak with somebody to help you through it.
Yeah. So one of the key points is not being afraid to make that suggestion of a counselor or a grief support group or someone to help them get through the grieving process. Yeah.
Yes, nowadays, I mean, we all focus. We're trying to focus more on mental health, which we should. So that's an aspect of it. It's if you're not okay, let's talk to somebody and see if that helps you.
Yeah. One of the things I learned over the years by doing many, many, many euthanasias is just teaching myself not to be afraid of the emotions. Because whatever the grieving process is for that person, there's a lot of emotion. Either they're going to shut down and they're just going to be like, just get it over with, doc, and get me out of here. Or they're going to want to talk a lot, or there's going to be a lot of crying, or there's so many emotions. And as veterinarians, it's so heavy because we're not mental health counselors that I think if we can get ourselves to the point where we don't let those emotions worry us or frustrate us or we don't run from them. I always tried to just be present with the client and, here's how it's going to go. Do you have any questions? And then asking them how they want it to go. Do you want to hold the pet? Do you want to be on the floor with the pet? Do you want to be in the room? Do you want to be out of the room? Like without judgment, because some people want to be there and some people can't. And like that's all okay. And just kind of having the conversation with the client and not being afraid of what they say. Because if you say, well, do you want to be in the room? And they go, well, of course I do. Like we're afraid to say that because we don't want to feel the anger. But if we can just be unafraid of that and just be like, we have to ask all the questions so we get this right. And then I think one of the hardest things because we're so busy is just staying with it in the moment. And so, like, we did the paw prints and that kind of thing, and we had little beads you could put on it and put the name. And so, for me, it was always like, okay, this is my appointment from beginning to end. And so, I'm going to ask all the questions. I'm going to answer all the questions. I'm going to stay in the room or out of the room, whatever they want. I'm going to let them spend as much time with that pet either before or after the euthanasia that they want. And then I'm going to say, okay, we're going to make the clay pod. Do you want to be involved in that? Do you not? Do you want to, write on we had these boxes that they could write messages on and just kind of being like okay with all of it, So if I had to sit on the floor and make the paw print myself and get help them put the beads on and make sure they were in exactly the right place. And do you like it here or here? Do you want it here or here? And just kind of like staying in it. I think a lot of times that part of it, if we don't fear it, is really helpful to the person's grief because we're not shooing them out the door and like prematurely stopping the whole, at least in the hospital grieving process, right? It's going to be different when they leave. But just being like open for that, and if the kids are there and they want to make artwork or paw prints or whatever, and just being like part of that whole process and not worrying about the rest of the hospital backing up. So I would just always tell my team, it's like if I have a euthanasia, I'm with that person until they don't need me anymore. And then I would always walk them right to the door and say goodbye. And if they wanted to hug me, great. If they didn't, great. It was just more like I would walk to the front door and open the door for them and, usher them out. But I think not being afraid of that. Like I think there's a big fear with, oh, how is this going to go? And what if they're sobbing? What do I say? And I don't think you really have to say anything besides just be there. Would you like me to stay with you? Would you like me not? I think that if we can learn those skills and to not be afraid of the emotion, it's going to make all the difference.
I think what's kind of important from that is having something set up with your team. How do we handle euthanasias? How long of a block does this get? What do we
Right.
typically do? What do we offer? Do we check them out before we euthanize? Do we check them out after? Do we send them a bill?
Mhm.
We had a doorbell and we'd have a plug and you
Yeah,
give them the
like a
doorbell.
little clicker thing
Yep.
that they could call you. Mm-hmm.
Guys are ready. Ring the
Great
doorbell.
idea.
Instead of popping your head, you guys ready? You guys ready? You
Yeah.
guys ready?
Yeah.
Like, and then they're sitting there waiting. Are they ever going to come back? Like,
Right.
so I think having that protocol from the receptionist all the way through till the end, just so this way, because you don't want the last thing you want to be trying to figure out when somebody's there to euthanize is what happens.
Yeah.
How do we do this? How do we handle it kind of thing? And
Yeah.
I think a important part of the grief aspect is focusing on our team as well. So we like to focus on the vets, we like to focus on the clients. Well, what about the techs? What about the receptionist? What about the receptionist that's taking that call? What about the tech? Is the tech in there with you for the euthanasia? How do they handle the euthanasia? Um this oh man, disenfranchised grief is what it's called, to
Okay.
where I'm not the dog's owner, but man, I'm really sad that that dog died today. Just
Yeah, you're invested.
right. It's not,
Mhm.
it's like the stranger that died that, well, they weren't my family. I didn't know them,
Right.
but I'm really upset. And people feel like they can't show that grief because,
Sure.
well, why are you sad? It wasn't your dog, Sally. Come on, we got to go into the
Yeah.
next room with me. Like,
Right.
disenfranchised grief, we need to know that that's another thing to learn is your text. If you don't already realize this, your text might very well be very attached to this dog. The
Hmm.
kidney cat that keeps coming in and getting fluids, or the heart failure dog that comes 2 to 3 times a week for whatever treatment.
And they're attached.
Right. And
Yeah.
so understanding and giving them time. Hey, John, you're really upset. I can see you're really upset about this dog, and I understand if you need to take a little bit of time, go
Yeah.
compose yourself, take a break. I know you were really attached to this dog.
Right.
That's okay to form these attachments and show that it's you're they're really upset that that dog or cat has passed away also.
Yeah, and I think giving them the option to either opt out or opt in. We had one technician that would get very attached easily. She's very empathetic, and there were a lot of patients that she was attached to. So then it was like she wanted to see the pet before it was euthanized, and the client wanted to see her. But then the conversation was, do you want to be involved or would you rather not? And sometimes she would be like, I can't be the tech in the room with you. I just have to say my goodbyes and hug the people and leave. Or she would say, yeah, I want to be the one. Like I want to be there for this one. And
Mm-hmm.
so just honoring that, I think is super important for your technicians because if they feel an attachment and it's better for their grief to be there versus maybe not be there, I think that that's a really important thing to consider because they're also grieving and they're going to carry that grief and that guilt if they weren't there or they didn't get to say goodbye, because sometimes the pet would come in on a day that they were off, and the client would say, "Oh, is so and so here?" And you'd be like, "Oh, no, it's her day off. Oh, I really wanted her to be here." And sometimes I'd say, "Well, we can call her and see if you just want to talk to her on the phone and, kind of have her say goodbye over the phone or on FaceTime or whatever."
Mm-hmm.
I think just kind of going overboard on trying to make this the best you can make it for the client, in
Yeah.
whatever way is super important.
Mm-hmm.
So, did they talk at all about how we then care for ourselves as the people that are handling this grief day? And I mean, some days 3 or 4 in a row, right? Like euthanasia, 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 and you're like, wow, I feel like the Grim Reaper today. Like, did they talk about that at all?
So yeah, they kind of went into a little bit with the like difference between compassion fatigue versus burnout. So I think we like to kind of use both of them interchangeably, but from what this was saying, so burnout, we're just tired of working, and that usually stems from something that's not managed very well. You're not appreciated at work, so you're just kind of tired of working for that group.
Right.
Compassion fatigue, so that's where you're just, yes, we're so empathetic for our patients. Yes, we understand that medicine's expensive and it's tough, and yes, I've had 3 euthanasias that maybe that dog could still be alive if the client had money, or that cat could have been fixed if they had money. Um, so it's really just realizing that, and we're all so different. What is your reset time? Some
Mm,
people are so the extroverts versus the introverts. Hey, I do better when I'm with a group of people. I need to be with my friends. I'm doing a guys weekend, girls weekend, whatever. Or are you the introvert that, look, I just want to read a book and be left alone, or just I want to just sit in the corner and cry. I just need
right.
to cry for a minute. So know yourself enough that you can feel everything building up and then be able to say, okay, this, what is your joy? Is it going to the gym? Is it going to the movies? Is it seeing friends or family or cross stitching or whatever it is you do, journaling, and make sure that you focus on that, and don't be afraid to tell people, your coworkers, look guys, I'm struggling today with all these euthanasias. So if I'm not in the best mood, that's why. And then for the staff to realize that too, it's most of the time as owners, you're usually the one focusing on your staff. You guys okay? You guys okay? You guys okay? I think it's just as important for your staff to say, hey doc, are you okay? Like,
Right.
nobody really.
They don't think about that, do they?
Right. It's not as common to come to the doctor and be like, doc, man, you had to make some tough choices today, but
Right.
I'm here with you. I think you did great. If you need anything, like the staff, and I don't know if it's just that power dynamic, but the staff seems hesitant. Are they hesitant to do that, or they just not think about it? I would think they're hesitant because as a doctor, you're an all powerful, so strong, you can wall everything off. We're not. You
Right.
might you
Yeah.
might ask your doctor, "Hey, today was a tough day. You made good choices. I'm here." That doctor might just start crying right
Sure.
in front of you,
Right.
just because it's so much.
Yeah. And so that kind of goes back to not fearing the conversation about death. Like that was your first point. It's like, okay, this is an important conversation. This is something that we have to do well, and we have to care for the clients and ourselves and the whole process.
Yes, and very one thing I found super interesting, just how we and just think about how people deal with death. Like, so my grandfather passed away. He passed on. He moved on. He transitioned. Very rarely, yeah, my grandfather died. Oh, that sounds so harsh. But my phone died. I got to charge it. My
Right.
TV died. My car died. It's
Right.
like inanimate objects. We have no issue saying
With
they
that word.
died. And that
Yeah.
was one of the points they made. Like it's very interesting to, like, how do we change the perception? It's okay. Fluffy will die, and it's okay. Fluffy's dead. Fluffy
Right.
deceased,
Yeah.
however you want to say it. But um, why, just as a society, are we so hesitant to say death?
To
And
talk about death. Yeah.
so,
Yeah, there's a lot of like scary emotions around that. And like all the more reason to work on that level is not fearing your own emotions, not fearing other people's emotions. I mean, that's one of the things I like best about coaching is part of the value in learning about yourself and how you handle things is so then you can know how you handle things and then you can help other people with the same issues and not being afraid to be in the room when they're sobbing and not being afraid. I had one guy one day come in just screaming in the middle of the waiting room, just yelling because he was at home and he found his dog dead
mm,
and he brought it in just like raging. And so everybody was like, just like scared because there was so much anger, but it was really grief. He was just shocked. And um, so it was like, go get Dr. Capel, and so I just had to like be brave and go out in the waiting room and ask him what happened. And he was just yelling at me like it was my fault. And, just that huge emotion. And the fact that I was able to just stay, like on the guard. Like I was hoping he didn't have a gun or something, right? But I really like stayed with him and just like, okay, tell me what happened. Tell me what's going on. Where's your dog? Let's go get her. Let's talk about it, and just kind of like let him get all of that out. Eventually, he came around and kind of calmed down and we were able to have a conversation. But I think that that kind of stuff is what freaks us out so badly about talking about death because we're afraid we're going to get that
Mhm.
and so I think if you can train yourself to be like, okay, this is how sometimes grief shows up, and it's okay because it's not it. They're yelling at me and blaming me, but it really isn't me. They're blaming the world that this happened to them,
Yeah.
So it's a really hard thing to train yourself in, but I do think that that should be part of the training is how do you handle big emotion?
I think it would be, and then to go even further would be like, especially with this, if you could have somebody in with the staff, hey guys, when that vet is taking the brunt of all this stuff, and maybe they are mentally strong enough to go through it, check on your doctor.
Yeah, on the inside, you're like, ah.
Right? Your heart's
Oh my
pounding out of
God,
your
I'm
chest
gonna
or
die.
whatever.
Yeah. He's
Yeah.
gonna kill me.
Right. So I mean
Yeah,
it's it
that's what your brain's saying to you during that time.
yeah, you're just, and especially now, like you said, nowadays, I mean, back in the day, people would just say their piece and leave, but
Right.
now it's not. I mean, they're going to burn your clinic down. They're going to shoot you. They're going to shoot
Yeah,
you and
that's
them
what goes through
themselves.
your head. Yeah,
I
it's
mean, so
scary.
it's a much bigger concern nowadays. So
Yeah,
even if your vet is strong enough and brave enough to kind of stand there and take it, it's still important that we're still humans too. I mean,
yeah.
still check on that, check on the vet, and make sure that they're okay and they're not missing anything.
Well, and it's also important to have the conversation in your clinic. Okay, if this happens, because in this particular case, it wasn't my client, it was another doctor's client. And she was just like horrified because she was thinking maybe it was something she did or her fault. And I asked her, I'm like, can you handle this? And she was like, I cannot. I can't go out there. And I was like, okay, I'm on it. I got it. And I
Mm-hmm.
just went out. And so just kind of knowing, who can handle what, who's better at this, who's involved. It's easier to deal with a client where you're not involved. Like if you don't know this client and the other doctor knows them well, sometimes it's better. It really just it depends on the circumstance, but I think being open to that in your clinic that not every time the doctor has to deal with it if they're freaking out,
Mm-hmm.
and just being like it's okay to come get help. It's okay to ask someone else to do it. There's no guilt, in that. And I think that is a really important thing to do. So what else did we not say that we need to say before we wrap this up? Is there anything else that you want to
Um,
get across?
I don't think so. I mean, I think the
I think
main
we
thing
covered
is
it
just,
all.
yeah, just covered as much as I would focus on that. Let's not make let's not make death such a taboo topic. Let's make it to where we're comfortable having it, and it would be really nice to like see at conferences and stuff like this instead of just focusing. We all love medicine. I love medicine. What's the new great thing? But let's have a conversation after that cardiologist tells us, yeah, this is the end of that heart failure case, so you're going to euthanize it. And now on to the next topic.
Yeah, rather
There's
than
there's a huge gap, in my opinion. There's a huge opening. Okay, doc. Wow, how do we how do we handle that when we
that
know the
is
dog's going to die, but
yeah.
there's a client that's attached to that?
Yeah, I love that. Well, tell people where to find out more about this certification, about you and what you're doing with it. If you're giving talks about it, how could they, if they're interested, get a hold of you or find someone else that's certified that could help their hospital talk about
So
grief?
my certification came from the American Institute of Healthcare Professionals,
Oh, okay.
AIHCP. That's where I was certified. I don't have anything independently yet. I'm trying to start working with some. It really again seems like the cremation companies are kind of the niche. Obviously, that goes hand in hand, the cremation and grief, loss, and stuff.
Right.
So I'm trying to work with some of them to get um, some of them to get some stuff started. But I
I
don't have
love that.
anything
Yeah, I think it's an
independently.
important topic.
Hmm.
Not just the euthanasia part, but the grief in and of itself, because it's a whole different thing.
Hmm.
Yeah, I love that.
Client to vet to support staff. Like it's, I don't want it to be ignored. Like, okay, let's just focus on the client, how they handle it, or let's just focus on
Right.
the vet. I mean, we got to remember our support staff are there dealing with it as much as we are sometimes.
Yeah, they get a lot of it because they get it on the phone sometimes. I love that. All right. Well, thanks everyone for listening. If you have any questions about this topic or you want us to talk more about it, or you have any questions about the certification that Dr. Pope has been through, just send me an email or you can email him. Where can they contact you? Is there a place that they can get a hold of you if needed?
Just on LinkedIn right
LinkedIn.
now. I'd say
Okay.
just find me on
Dr.
LinkedIn.
Lee Pope.
Hmm.
Yeah, you'll find him. Well, I appreciate you talking about this. This was a good subject. I think it's something we don't talk about enough.
I would
Thank
agree.
you for asking me to come back on and talk about it. It's cool.
Yes, ma'am. I appreciate you having me back.
I love this. Thanks for listening, everyone. Have a beautiful week. Bye.